I would like it if you're okay with it for me to tell other people about your story, because I think a lot of people relate to you specifically. I should preface too, we've just started to do the filming in the rooms. Before we were just asking them for testimonials, and that was good, but there's nothing like that initial reaction. One thing that I think is really cool that we do is different, is that we have photos of our patients spread throughout our office.
Is there any specific software that you're using for CRMs or anything like that that's helping you guys kind of manage these leads, or how do you manage these opportunities as they come in?
They're more than capable of really understanding the restorative aspect, because I think that that's like kind of a low-hanging fruit for us GPs.
Welcome to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. Today, I have a special guest, Dr. Graf, who's practicing and seeing more full arch cases. And he gave me some ideas on how to grow your practice that you're going to love. And he goes into detail, and some of them I've never heard before. So you're going to want to stay tuned for this show. All right, Dr. Thomas, so why don't you tell me what the number one driver behind your full arch growth right now is?
The number one driver is word of mouth currently. Obviously, you spend the money on Google ads and video, et cetera, but that word of mouth is really, being from a small town, that's really what is the well, I feel like the lowest hanging fruit. So every single patient that we finish, we're asking for testimonials. And that's intentional, because that's at the high point where, in the entire process for them, and to nail that high point, at the right time, and to ask for testimonial. And I'm sure, those patients, when you do put them in that final zirconia, they usually want to go to war for you. It's awesome. That's why I think I love full arch so much.
Yeah, I was just doing another show and I was asking a doctor why he loves full arch so much. And he literally said, like, sometimes you can do a filling for somebody and it's like, kind of like, whatever, thanks for the filling, doc. And you they're appreciated, but when you change someone's smile, it absolutely changes their life. And I absolutely agree on asking for referrals or asking for testimonials. And I think a lot of people talk about it. Very few people execute on it. There's some fear baked in there, I think, with maybe team members or lack of process. So I would love to go into that. So you said, you finish treatment, you hold up the mirror, you say, how are things going? Let's pretend I'm your patient. So you're like, all right, Gary, how do you like your smile? I'm like, man, you changed my life. I can eat now. I can smile now. What's the next step of your process to make sure you get the right kind of testimonial?
Yeah, so we're actually now, we're starting to, we've been messing around with actually filming as soon as they come in the room, and not necessarily telling them. And we'll, of course, later ask if we can use that.
Yeah.
But that initial reaction when they first see it that's where the sweet sauce is. And so, we're pretty methodical with our delivery days. We made sure to put the patient's original photo up on the TV as soon as they walk in the room, so they can be thinking, remember where you were. Mm-hmm. It also helps kind of like not allow them to focus on like the little tiny, things that they might think is, doesn't look good, but we know that functionally they need it.
Yeah.
And then when we're stringing in the final time, I'll usually go in front of them before I hand them the mirror and talk about their surgery. And look, if you remember, like, you came to me, 6 months ago because your teeth were failing. You had pain here. We decided we placed 4 implants on the lower. We placed 4 implants on the upper. You've done everything right. The healing process for 3 months, and now here you are today. We're delivering your prosthetic, and do you want to see it? And of course they say yes. And I usually try and bring as many team members into the room as possible, because I think that's powerful too. And not only for the patient, but I think for my team to get the value out of that as well.
100%. Yeah.
Yeah. And so then,
sorry to disrupt the show, but I got something crazy to share with you. We are attempting to connect with all of our listeners. We have thousands of people that listen to this podcast, and we want to meet you in person. We have 4 events coming up, and I want to give you a discount code that you can use for the next week to save $300 off your ticket. The discount code is Gary Bird, and the link is going to be just down below. You can also go to smcnational.com/events. I hope to connect with you in person and help each other grow our businesses. Can't wait to see you soon. So you're recording. So in your office, you're kind of recording all the time, and obviously you can't release that without their permission, but that comes later in the process. So you're recording that process. There's probably tears. There's probably a lot of joy, tears of joy, of course. There's, they're so happy, they're overwhelmed. You show it to them. You walk through the process of, hey, this is where you started from. You have it up on the screen. And I hope people catch that before and after on the screen, because it's been a while, right? There's a process of getting these added. And then now they're super happy. When do you interject, hey, we're recording this, can we use it?
Yeah. So usually it's me saying that. And usually it's after we just had conversation, the patient's about to be dismissed. I'll say, look, like, we've been recording it. There's a little camera up in the corner here. Usually GoPro, what we use. Almost like, you are perfectly able to say that you won't allow us to use this, and that's fine. But I would like it if you're okay with it for me to tell other people about your story, because I think a lot of people relate to you specifically. And I kind of like hint, were they a dentist when they first come in, then I'll say there's a lot of patients that are walking around with dentures that just don't know about this. And so you can help them. And so
what's your conversion rate? What's the conversion rate? So if you have 10 patients that come through and accept treatment, and you ask them, how many of them are like, yeah, you can use it?
Oh gosh, like 9.
Oh, so most. Okay, cool.
Yeah, it's almost all of them. The ones that choose not to are like usually the younger patients that are just like, okay, I don't want people to know that I have implants.
Totally.
Which makes sense.
Yeah, totally makes sense. And then what's the next step? So now you got this video, you got this amazing video where you walk in, you get the before and after, you get the excitement, and you have it all captured on film. Now, what do you do with that? How do you get that back in front of people to help get more full arch cases?
Yeah. So I should preface too, we've just started to do the filming in the rooms. Before we were just asking them for testimonials, and that was good, but there's nothing like that initial reaction.
Yeah.
And so we're planning to use that for Google advertising specifically. And we're angling it towards, get a normal life back, and more of like explaining the process of like, this doesn't have to be, 12 months, and it doesn't have to be full of pain. This is actually a pretty straightforward process. And I should have noted too, usually when you tell people that they're being filmed or the camera in the room, they typically will like ask to say a couple things as well. So if they're open to that, then I'll kind of interview them a little bit, and I'll be like, tell me what you were thinking on the day that you come in for a consult. Why did you decide here versus something else? Just try and extract as much content as we can from them, because we know that those are the moments that are so hard to replicate in the future. And everybody relates to that, right? Yeah. Everybody thinks that, it's impossible to get to the finish line.
Yeah. Yeah. And the thing I love is that dentists are very detailed, right? So dentists are very process driven and very, they're perfectionists, and they care about every detail. That's why they're good at dentistry. And the problem is, though, with marketing, no one cares about that. They care about the outcome. And what you're doing is you're showing, no one wants to know about when you go to buy a car, about the credit approval process and the warranties. We don't care about any of that. We just want to see ourselves driving in that car. And that's what you're capturing, is you're capturing the end result, and then you're using that in marketing. And that's so powerful. Like that's the part that gets lost in the sauce a lot of times when we're trying to tell people about this amazing, almost borderline miracle transformation that we're experiencing. We want to tell them like, no, this is all in 6. It isn't all in 4. It's this and not this. And those things matter, and it's going to come up in the process. But in the marketing, the beginning should really be about the ending. And I love that you're capturing that.
Yeah. Yeah. And I think it just makes everything with the marketing aspect, when you have that content, it just makes everything easier. And we have patients all the time. We have a dentist patient walk in for a consult. They're a little bit hesitant. We'll show them the video. And my office manager, when we do the consult, like, hey, you know what? We have someone exactly like you that just finished their treatment. Like, would you mind if we show you like what this looks like?
So your team has a library to work with that they know, like, oh, Mr. Smith was a veteran and he had dentures before, and now we have this other vet and they have dentures and they're kind of hesitant and they're not sure if they can trust us. That's huge. So this is more of along the lines of the conversion side, less so about the marketing.
Yeah. Yeah. And we also have patients that are willing to take phone calls for us. If like, and for that, in return, we offer free cleanings for them as long as they continue to answer their phone whenever we ask them to. Because, just like anything else, sometimes the consult patient just wants to hear from someone else that has went through it. And I understand that. We get that. We're not trying to sell them something that is not in their best interest. I think all of us doctors would agree that this is the best treatment for our patients. It's just getting the patient on board and allowing them to trust you. That's the hard part.
Awesome. That's so good. Is there anything else that you're doing either around these videos or anything else that you're doing that's helping you get more referrals?
One thing that I think is really cool that we do is different, is that we have photos of our patients spread throughout our office. And there's photos that actually can spin. So when you look at it, it just looks like a normal picture, and we'll tell our patients, hey, like, if you see pictures on the wall of patients smiling, like, you can actually push the picture frame in and it'll spin and it'll show you the before.
Wow. That's so cool.
A little bit of a description, like patient was a dentist or something, or this was a veneer case. And so it's really interesting to like see the patients, and we put them specifically in front of like the CT machine that they have to stare at. So it's cool to see them like go and turn the photo.
Where'd you get that idea? That's such a good idea. Where did you see that somewhere else, or did you just kind of come up with it?
We actually did come up with that one. A lot of the ideas I used were not original by me, but that was, we hired a gal for full-time content creation, and we generated that idea at a marketing meeting, and I was like, that's gold. That is golden.
It's so good. That is so good. I've seen the befores and afters. Everybody has, right? But they're usually very clinical and stale, right? Like they're like, right. They're just like, or they're just the mouth, right? And you're like, okay, cool. Your teeth look better. But having that before and after where you can see the transition, that's really cool.
Yeah. Yeah. So, that's been really cool. We just started doing that like a month ago, and gotten such a good response from patients, and, yeah, it's just being really cool. I think it's a great idea.
That is a great one. It's
also like not great to just have ugly pictures in your office of like before, right? So it's nice to like flip it over so it's a nice smile. Then
so it's all nice smiles, but you can touch on them if you're interested. Yeah, I agree. Yeah, that's really, really good. Is there any specific software that you're using for CRMs or anything like that that's helping you guys kind of manage these leads, or how do you manage these opportunities as they come in?
So we tried a handful of things. And I guess, mind you, I'm no expert by any means. Like, I lean on a lot of people for advice. And I have a marketing background myself. I really enjoy it. So the analytics is something that I enjoy. But to answer your question, we do a lot of things that don't work, or at least we've learned over time.
That's part of marketing. Yep, that's part of marketing, doing stuff that doesn't work.
Yeah, we're right in the middle of using virtual consult and trialing that out. And I still don't have a final decision as to like if I think it's going to be beneficial or not. I think in certain situations it's very beneficial. And all we're trying to really figure out there, or we're trying to, and we all do this, but we try to communicate with the future consults as to like how much this costs without telling them how much it costs.
Yeah.
Right. So for that little tagline on there, oh, you're interested in implant dentures, perfect. It's this much per arch, and probably 80% of them will stop filling out the form. But essentially, that's our goal, right? Just to focus on those 20% that understand the cost, still want it, and now would come in for a consult.
That's awesome. Yeah, the virtual consults work really well in most markets. It's just it's the way I think about it is you have a funnel, right? And all you're doing is opening the funnel wider at the top, and then working through those. The one thing that we're working on right now with a finance company is they call it a red light, green light. And what they do is instead of, so what you do is you want to sell the value first, right? So you say, hey, this is what we can do. This is how we do it. This is how it's going to change your life. And then when they're bought in on the value, then you say, hey, do you have financing figured out for this yet? And if they're like, no, you can run them through a soft check and get them a green light or a red light. Now, the green light, red light, 70, 80%, accurate. So it's not 100% accurate. But what you're doing now is you're putting it more on the financing side rather than the dollar. Are you good with $30,000, $40,000, $50,000, whatever? Now you're more having a conversation like, cool, you are pre-approved for this. Now, and so you're still getting that filter effect without presenting price before value. Because if you present price before value, then people start getting confused, and they can go to Mexico, right, or wherever you can go to somewhere else and get a cheaper price anytime.
Yeah.
So we've had a lot of success with that. Let me ask you this: so you're in a stadium, you got 30,000 doctors in there. And there's two groups that I really want to focus on that I want to help the most. Is that number one, you have the GP offices that want to add full arch. And on the other side, you have the specialists that have been doing this full arch work for a long time, but they've largely been referral based. And the referrals are starting to dry up because people are bringing more full arch in-house. So they're having to go to direct to consumer, but it's hard, right? It's not easy just to flip a switch and start doing marketing. No. So to those two audiences, if you had just one message to tell them about the kind of work that you're doing and how to keep going down that road, what would that message be around?
Well, the same message for both parties. I would say, get yourself an in-house lab and start restoring the cases yourself, because oral surgeons are more than capable of restoring these cases.
Yeah.
And GPs, they're more than capable of really understanding the restorative aspect, because I think that's kind of a low-hanging fruit for us GPs. It's we know oral surgeons they don't understand the restorative process. So that's where we can, gain some traction. So I would say both as an oral surgeon, who does the surgery, they should really learn the prosthetics, because I know some oral surgeons that, care more about their access holes more so than their tort value. And the opposite, with GPs, they just care about the access holes and not as much the tort value. But I think that just learning the restorative is going to help with everything in this situation. And having your own lab, man, that's made it a lot easier for me to market this, because as you probably know, patients don't want to go somewhere else for a prosthetic, nor should they. I mean, goodness, you done the surgery, you're in tune, you're the most in tune with what that prosthetic is supposed to look like.
Well, not only do they not want to do that, they don't expect it. So we've all had this happen before. Your car breaks down, you take it into the mechanic, and you're like, hey, fix my car. You're a mechanic. And they go, oh, no, that's a muffler problem. Take it down to the muffler shop. And you're like, I thought you were a mechanic. Right? That's, I know it's not that simple. I know it's not that simple, but the patients, when they come into the dentist, they and you say, yeah, I can give you your new smile. They expect you to do the whole thing, not to get it half done and then go negotiate pricing at you got to beat up pricing over here and get everything financed and everything. And now I got to go do the second part of it and the second leg of it. And it's it's a lot. And patients don't want that. That is not ideal for the patient. I understand that sometimes that's necessary. And not everybody can have this perfect world, but I'm totally with you. And I think that is a great piece of advice. Anything else that you think we didn't cover that people would like to know? You've hit me with some good ones I've never heard before, so I want to make sure to pick your brain as much as possible.
Yeah. Well, I mean, just going back to the last one again, I think that, it's the price shoppers when they come in and we're like, oh yeah, like we have our own in-house lab. We customize everything. We're going to give you this, this, and this. If your zirconia breaks, like just give us 2 days. We can make you another one. Like we hope that doesn't happen, but if it does, we got you. And I think that the patients that are like on the verge, like, I know I need this, but I'm a little bit hesitant. Like that's enough for them. They're like, you know what? If it doesn't go exactly as planned, then at least like he's got his own lab. Everything is here. Like he's telling me.
So those are people who've probably, people who've been through the ringer at other offices, right? Where they've jumped office to office to office because they were like referred here and referred back there and referred there. And so they come to you and you're like, no, we got you. That's the game changer.
You'll do the surgery and make the Prozac? Yeah, you can do that. Oh, that's great. Okay.
It's all good.
Cool.
That's awesome.
And I also think it helps with the referrals because around me, a lot of the doctors don't restore all NX very often. They're older age groups. And so I have approached every single one of them. And I was like, look, I can make this the easiest, $10,000 that you will make. Like I will make your prosthetic. Like I will do the surgery and I will basically I will hand you the prosthetic and 4 screws to screw in and you can charge what you want. And for me, that's just easier because I can control my implant positions. I can control my prosthetic. Like I win. Okay. They get a little bit off the top for doing nothing, but it's really not that much more difficult for me.
That's so good.
If you do the surgery correctly, the restorative process is pretty straightforward.
That's awesome. This has been a gold mine. I really appreciate you sharing your expertise. It's going to be really, really helpful to the audience. Thanks so much for coming on, Dr. Thomas.
Sure.
All right.
Have fun. Thank you.